Hello, everyone. Welcome to the MICRA Webinar on communities after COVID. We'll be starting the webinar in just a minute or so. Let's just give ourselves another couple of minutes for a few of the latecomers, and then we'll start our presentation. While we're waiting for our final few participants to join in, I'm really thankful that all of you have come for this webinar. It's the second in our series on life after COVID. So I'm really grateful that you're continuing to participate in our MICRA activities. For those of you who are unfamiliar with MICRA, MICRA is the Manchester Institute for Collaborative Research on Aging. And I think we have got nearly everyone who's registered so far for the webinar here. So we'll start right now. So welcome again to everybody. This is our MICRA webinar on communities after COVID-19. MICRA is the Manchester Institute for Collaborative Research on Aging. And my name is Tarani Chandola. I'm the Deputy Director of MICRA. This webinar is the second in our COVID-19 webinar series. And in this webinar, our speakers will be talking about the impact of social inequality on our communities in the context of the pandemic. We have a great lineup of speakers. They are Professor Chris Phillipson, Dr. Sophie Yarker, and Dr. Tina Buffel. All our speakers are from the Sociology Department at the University of Manchester, and they are part of the Manchester Urban Aging Research Group, which is an interdisciplinary research group bringing together scholars from sociology, geography, social statistics, anthropology, architecture, with an interest in researching the relationship between population aging and urbanization. All our speakers will be speaking for about 10 minutes each, and we will have questions at the end after they have all spoken. So I'd like to welcome our very first speaker, who's Professor Chris Phillipson. Chris is a professor of sociology and social gerontology, and he's also the former director of MICRA. And one of the reasons why MICRA has been so successful in aging research is because of Chris's leadership of MICRA. And he'll be talking about the impact of social inequality in our communities in the context of the pandemic. So Chris, whenever you'd like to start, that'd be great.
Many thanks, Tarani, and welcome everybody. And I'm delighted to give this presentation on communities after COVID and looking at, in particular, at issues around inequality. Could I have the first slide? So really my theme is that clearly there's a lot of work going on in the neighbourhoods and communities in which we're working, trying to strengthen their capacity to tackle the issues that are coming up under COVID-19. But I think my argument is that we're going to need a new community development policy. And I don't think we've heard enough about the community development issue overall to protect neighbourhoods over the longer term. Simply because poorer communities, many of the communities in which I'm sure many of those who've come into the webinar working, will inevitably make a slower recovery from the present crisis. And that may become especially significant if there's a second wave. Now, why are neighbourhoods important? Well, I think there are three, as a sociologist, I'd say there are three main reasons. Firstly, they do support people or can support people in periods of crisis and stress. Secondly, of course, they're especially important for some groups, particularly older people who, even before COVID, the evidence was people spend about 70% of their time in their home and immediate neighbourhood. But the third factor is that informal relationships within communities are very important. There's a phrase from a piece of research by Paula Gardner called natural neighbourhood networks. And these refer to the friends, neighbours, family, strangers even, who help to maintain relationships within neighbourhoods. I'm going to come back to that concept of natural neighbourhood networks in a minute. Next slide. So I think that a number of issues have come up in terms of why we think neighbouring has become more important. One of the things that struck me is that there's been a lot of discussions about neighbours getting closer during COVID-19. This is an article from The Guardian, or a comment from The Guardian. In a strange and unsettling time, many people have been experiencing something similar, a greater sense of neighbourliness, new friendships forged. Across the country, people who previously shared only a postcode have joined together in pavement aerobics, sing-alongs, and so on. Next slide, please. But of course, we also know that not all neighbourhoods are equal. So whilst we may be celebrating neighbourliness, there are real pressures on our communities. The Office of National Statistics have reported that those living in the poorest parts of England and Wales are dying at twice the rate from COVID-19 as those in more affluent areas. And of course, we know that COVID has had a disproportionate effect on BME communities, and that reflects cumulative inequalities in relation to deprivation, high-risk jobs, poor housing, and racism. And inequalities between neighbourhoods mean that some groups and individuals have been more exposed to the virus than others. And in my view, that's a real social justice issue. Next slide, please. We also know that to some extent, there was a failure to protect communities from COVID-19. I think additional government funding should have been provided for areas with high BME populations, and we should have been pushing additional funding to charities supporting the community. We also know that the poorest communities in England and Wales bore the brunt of the 900 million cuts to public health over 2014-2019. And that meant cuts to obesity programs, cuts to anti-smoking programs, cuts to alcohol education. And all of this has been, to some extent, reinforced by pressures on the voluntary sector that estimates to lose about £4 billion of income as a result of the changes with COVID-19. So what do we do? Next slide, please. What can we do about this? So I think the question we should be asking ourselves is, how can we shield poorer communities from the consequences of COVID-19 and or from a second wave? And I've got 6 suggestions to start off a debate. Firstly, I think those natural neighbourhood networks are important. The networks within communities, those informal networks, have great public health potential, but we'll need to recruit more community workers to work with those networks, support those networks, allow them to flourish in different ways, protect isolated groups within those networks. So I think supporting the networks within neighbourhoods is going to become extremely important. Secondly, we need to develop stronger organisations at a neighbourhood level. Many communities do already have these, but they vary too much. They're too random in terms of whether you're living in a neighbourhood with a strong organisation or one where the organisation is much weaker for various reasons. So I think we need to be thinking about what sort of organisations we want, how can we strengthen them so that they are able to negotiate with the different service providers in local, both local and nationally. Thirdly, housing is going to be crucial. One of the important findings, I think, emerging from research is how overcrowding, particularly in multi-generational households, has been a significant factor in spreading or in causing exposure to COVID-19. And housing, tackling poor housing, I think, will be a priority. Next slide, please. So 3 more thoughts to conclude. Care homes, I think, will be a vital area to think about in relation to the community. And they need to be integrated and not isolated from the community. I mean, my view is that there's been so many failings in terms of care homes. But one of the reasons is that over the years, we've socially distanced ourselves from the care homes within our midst. And tackling that, I think, will be essential for shielding them in the future. Discrimination is very important. Racism, sexism, and ageism has been a big feature in terms of the way we've understood that communities have experienced COVID-19. And there is clearly evidence that the racism affecting different minority ethnic groups has been a factor in the degree of exposure and poor outcomes of those communities. And finally, funding. And this is, the fact is that after 2010 with austerity, we had poorer areas receiving less money from central government than richer areas. So we need redistribution. Got 2 final slides, if I could have the first one. And this is very interesting. This is from Office of National Statistics Opinion and Lifestyle Survey at the end of May. And people are asked, how united or divided do you think Britain was before and will be after we've recovered from COVID? And this asked nationally representative sample, about 1,200 people, I think. And here you see, actually, it's quite interesting that there's an increase from quarter to 43% who feel we'll be more united after COVID-19. So that looks quite promising, doesn't it, in terms of coming together in communities. But final slide. Also asked, the same survey also asked how equal or unequal do you think Britain was before or will be after we've recovered from the COVID outbreak? And this is also very interesting. Hardly any change. Half of our population think we'll still be unequal. And it's that message of inequality that I think is going to be a crucial issue to tackle going forward. Thank you very much.
Thank you. Thank you very much, Chris. You kept brilliantly to time. As I mentioned at the start, we're going to have questions at the end of all our speakers. But in the meantime, please do send in your questions to the chat function. So there's for those of you who are unfamiliar with Zoom, you need to hover to the bottom of your screen and hover your mouse towards the bottom of the screen, and you will see a chat icon. Just click on that and start typing in your questions, and I'll make a record of those questions and come and ask them towards the end of the all our speakers today. So our second speaker is Dr. Sophie Yarker. Sophie is a research fellow working on the Ambition for Aging program, which is led by the Greater Manchester Centre for Voluntary Organisation. And she's been with us. She's at MICRA since 2018. So Sophie, whenever you'd like to start, that would be great.
Thank you, and thank you everyone for joining us today. So yeah, I work on the Ambition for Aging programme, and this has been a 5-year programme running in Greater Manchester, just finished earlier this year, funded by National Lottery, and it's been working towards tackling social isolation for over 50s and building age-friendly communities across Greater Manchester. And a lot of the work that I was doing on that programme was looking at the importance of social infrastructure So looking at how public places can benefit older people in terms of building and maintaining social connections, and how this kind of feeds into building age-friendly communities. So what I want to do today then is to kind of restate the importance of social infrastructure in the context of COVID-19, and offer some reflections on some of the issues around social infrastructure, particularly for how we might move into a more prolonged phase of living with the virus, or a new normal, however you would like to describe it. So just quickly then to go over a definition of social infrastructure. The sociologist Eric Kleinberg describes it quite extensively as the physical spaces and organisations that shape the way people interact. So it's any public place in a neighbourhood where you can have any type of social interaction with people. And we need to think really holistically about this. So we can think of the obvious examples such as community centres, community groups, leisure centres, etc. But also we need to be thinking about commercial spaces such as restaurants, pubs, cafes, shops, markets, public services such as public libraries, but also public transport infrastructure, and green spaces as well, parks, walkways, and other kind of public spaces like squares and plazas, etc. So we're thinking expansively about the types of spaces we're talking about, but also thinking quite broadly about the types of social interactions that people have in these spaces. So these are spaces where you can go and meet friends that you already know and have interactions with them and build quite strong bonds. But there are also spaces where you can have kind of more fleeting interactions, maybe just say hello to someone that you recognise on the tram every day, or someone that you recognise walking in the park when you're there every day, etc. So they can be very fleeting, informal interactions and more what we would call weak ties, so more like acquaintances, or they can be kind of stronger social connections as well. So it's important to kind of keep both of those in mind, I think. Right, inside. So why is social infrastructure important, and why is it important for age-friendly communities and for supporting older people's social connections? So again, this is a quote from Kleinberg, and he talks about when social infrastructure is robust, it fosters collaboration, mutual support, and collaboration amongst friends and neighbours. So this is not just about promoting places which are friendly and welcoming. This is about promoting places that are able to form the basis of mutual support, and different forms of informal connections to build a support network for people living in communities. And we've already heard from Chris about how important this is, particularly for older people who are perhaps spending longer and more prolonged periods of time in their neighbourhood, particularly within the context of COVID-19. So these are spaces important for kind of social interaction and social networks that develop from them. I also think it's interesting what Kleinberg mentions here about the kind of degradation or kind of disinvestment in social infrastructure. So he talks about it when it's degraded or when it's not invested in, it can inhabit social connections, leaving families and individuals to fend for themselves. Kleinberg did a lot of research around social infrastructure in the context of a different type of crisis. He looked at the 1995 Chicago heatwave, and he looked at two different communities which on paper had very similar kind of socioeconomic backgrounds, but the death rate attributed to the heatwave was much higher in one neighbourhood than the other. And based on his analysis, he concluded that it was the presence of good quality, accessible social infrastructure that made the difference in people being able to ask for and also being able to receive help within the heatwave crisis. And we can maybe think about that a little bit in terms of the COVID-19. We've certainly seen the emergence of really strong mutual aid networks in particular types of neighbourhoods, and we would argue it might be neighbourhoods that were already quite well resourced, already had these social infrastructure that supported the types of social interactions and social networks that then lend themselves to the type of social support. So just in terms of when Kleinberg talks about the kind of degradation of social infrastructure, I think it's important in the context of thinking about inequalities to highlight some of the inequalities around social infrastructure within the UK and also in Greater Manchester. So due processes of austerity, we've seen the removal in one form or another of many of our public spaces and communities. So Hitchin and Shaw have argued that there's been the removal of 12,000 public spaces from local councils since 2010. We've also seen the closure or the kind of the shrinking down of services for lots of public libraries. But this is not just about public services, this is also within our high streets as well. So there's a lot of discussion about the decline of the local high street. And again, this is the removal or the kind of absence or shrinking of spaces of interaction and social connection across our communities. So I think we'd argue the point that going into this pandemic, many of our neighbourhoods were at a disadvantage of being able to respond to the kind of networks of informal support in communities already. So I just want to say a little bit then about the implications for older people of restricted access to social infrastructure. So restricted either because these spaces have had to close because of the pandemic, or because they're running at a very reduced service, or restricted because older people for some reasons are being asked to stay at home, either because of their age or underlying health conditions, or because they're carers. So one of the kind of main things that we've been hearing from the communities that we work with and the organisations, and also based on research we've done previously, is if you can't access these spaces, you're very much then cut off from your social connections and your support networks. This is not just about being lonely in the sense of not seeing someone to talk to, but it's about not being able to ask for help as well. So people are being cut off from those networks, which are quite devastating effects, I think. As much as we have seen a lot of growth of neighbourliness and kind of people looking after their neighbours, as Chris mentioned, there are certain groups of older people that maybe feel alienated from this more locally based support. So we're hearing particularly from the LGBT community that older people who identify as LGBT, their social networks and their support systems tend not to be based in the neighbourhood they live in. They maybe have extended networks across the city or across the UK. And if they're not able to access those, they might be feeling quite alienated from the networks in their local community if they don't feel safe enough to kind of identify within those communities. There's also obviously health and wellbeing implications, so mental health certainly, but also physical health and just not being able to get out and be as active and mobile. And crucially, I think, particularly in the context of ageism, which we've been discussing a lot in the wake of the pandemic, is if older people are not able to access social infrastructure in the ways they have been, there's definitely an implication of not being visible or feeling valued in the communities and in society as much. We've heard a lot about older volunteers who are very active in their communities, and all of a sudden they either can't go to those spaces because they're not open, or they're being told to shield and stay at home. And I think that has a big implication for how valued and visible older people feel in their communities and also in society more broadly. Just wanted to highlight a little bit of some of the kind of outreach work that some community organisations have been doing, community organisations that particularly work to support older people in their neighbourhoods, and how they're finding new ways of adapting within social distancing restrictions. So I mentioned the LGBT community earlier, about some people feeling alienated from locally based neighbourhood support. So there's a telephone befriending scheme set up called Rainbow Brew Buddies, which is based on people ringing each other to check in and check they're okay, etc. So kind of working around that kind of very local based neighbourhood support for people who that's not maybe as appropriate or useful for. We've seen a lot of the work that Ambition for Ageing has done has been about bringing older people together around food. And obviously that's not, we're not able to do that at the moment. So a lot of those organisations have switched to doing food delivery. So that's obviously first and foremost about feeding people, but it's also about maintaining those connections there in some way. And there's obviously been a huge expansion, as this webinar is testament to, of online and digital communication and people staying in touch in that way. So this is an example from Sport of England around mobility and balance classes that are being kind of provided online for older people in their homes. And obviously there's a huge issue here around digital exclusion, which I don't want to get into, but you know, there's been a kind of big shift in terms of innovation of how different organisations have been working. And as much as the kind of digital innovations have been really important, and I know any kind of recovery that's been discussed has taken a big focus on making sure that more older people are able to get online if they want to, so they're able to have access to that form of communication and interaction and connection, which is hugely important. However, I think we also need to make sure that any age-friendly recovery also looks at the continued importance of shared spaces and physical spaces for older people and younger people alike. And I think it's really important that we don't lose age-friendly principles in social infrastructure, that they don't fall out of the kind of focus in terms of how we try to get back the new normal. And if we're thinking about how social infrastructure can function in the future, how we can still maintain social distancing, but also make sure that social infrastructure is still able to provide its social function. I think there's a few different ways we can do that. I just want to kind of finish on now. So a lot of the research that has been done previously has shown that it's not just verbal communication and it's not just strong social connections that are important. It's also about the fleeting engagements you have with people and the kind of acquaintances that you build. And so the first image here, smile and say hi to everyone you pass today, is from Chorlton Water Park, just down the road. And I think this really highlights how important just smiling and saying hello to someone and recognizing people can be. And I think, you know, all of us are going to be changing how we have our social interactions. And I think this type of weak ties and informal social interaction will become more and more important for all of us. As I think we need to make sure that as we kind of reopen social infrastructure, we still find ways of maintaining this kind of informal, fleeting interactions with people, even within the context of social distancing. The importance of green spaces, I think we're all probably using green spaces more and maybe finding new ones that we've not used before in the context of COVID-19. This won't come as a surprise to people who work in this area, but it's not just about having access to green spaces, particularly for older people. They need to feel like safe spaces. They need to be designed in certain ways which is accessible for older people. So again, we need to just remain more mindful, I think, of that, and particularly as green and open spaces become more and more important as social infrastructure. We also need to make sure that we maintain vibrant and accessible high streets, because we've seen how important commercial and kind of leisure spaces have been to older people, and we need to kind of make sure that that doesn't get lost. As we rush to reopen the economy, we also need to be mindful of the social economy of these places, and whatever social distancing practices are brought in so that various shops can open, we need to also try and maintain the element of sociality around these spaces as well. And then finally, just the very practical issue of seats and toilets, which I know has been a kind of bedrock of social infrastructure, age-friendly work in the past and continues to be so. But I've heard a lot of older people say, you know, it's great that we can maybe go out more than we were before, but if there's not somewhere to have a seat or be able to access a toilet, then that is still limiting people's individual mobility and individual access to these spaces. So I think we need to remain mindful of that as well. So just finally, to kind of conclude, I think any age-friendly recovery needs to include our shared spaces just as much as it does our digital spaces online. We need to just remind ourselves that the social aspect of our shared spaces remains crucial even whilst we're observing social distancing. And this can be done still, I think, through informal and non-verbal contact and encounter with difference, as this is vitally important for older people's sense of connection to where they live and also connection to other people around them. And just to kind of finish, to go back to Eric Kleinberg, he wrote a piece in the New York Times talking about we need social solidarity as well as we need social distancing. And we know from so much of the research on public space that public spaces are crucially important for bringing people of different backgrounds together, for allowing people to have some form of encounter with difference, whether this is people of different generations or intercultural interaction. And I think we've seen from events in the US just how important the ability to be able to have contact with people who are different from yourselves and gain an understanding of difference through those interactions. So I think there is kind of broader implications for social cohesion and solidarity. And particularly if and this links back to what Chris was saying about how if we're going to come out of this a more kind of equal or more united UK, I think if a lot of the public health messages are appealing to people's sense of a greater good, then we need to have a clear sense of what that greater good is. And we only will have that if we have a strong sense of social solidarity. So again, the kind of importance of these public spaces and allowing us to see each other and just know we're around other people, I think will become more important in that as well. So just some implications for age-friendly recovery, but also some broader concerns around inequalities and communities. So I will finish there. Thank you very much for listening.
Thank you so much, Sophie. Thank you also for keeping to time. As I mentioned at the start, we'll be having questions right at the end of all our three speakers. So please do keep your questions and write them in the group chat. I've been monitoring the group chat, and so far nobody's asked any questions. So please do ask your questions in the group chat. We'll be coming towards I'll be asking those questions to our speakers after our final speaker has talked. And I'm just going to introduce our final speaker for today, who is Dr. Tina Buffel. Tina is a senior lecturer in sociology at the University of Manchester. And she'll be talking about building back better and developing age-friendly cities post-COVID-19. So Tina, whenever you're ready, please go ahead.
Thank you so much, Tarani, and everyone who's organized this webinar. So my talk is going to build upon some of the issues Chris and Sophie have mentioned, and the aim is to open up a discussion about how we can build back better after COVID-19, with a particular focus on what that might mean in the context of developing age-friendly cities. And I will start with a bit of background to this concept of age-friendly cities, to then discuss some of the challenges posed by COVID-19, as well as ways forward, both in terms of developing a recovery strategy, as well as a research agenda. So the research of our group focuses on two of the most important demographic trends facing contemporary societies: population aging on the one hand and urbanization on the other. And understanding the interaction between those two is especially important because cities are where the majority of people are now living and aging. But a key issue is that demographic change is often occurring more rapidly than cities can respond to or adapt. And one important response has come from the World Health Organization, who developed this model of the age-friendly city to assist the policy goal of aging in place, or supporting people to age in their own homes and communities for as long as possible, rather than in residential care. And an age-friendly city is defined as an inclusive, accessible environment that is responsive to the needs of people as they age, and that has attempts to improve aspects of the physical environment, the social environment, as well as health and care services. And building on this model, the World Health Organization developed the global network of age-friendly cities and communities in 2010. And this now brings together over 1,000 cities across the world that are committed to adapting their structures and services to support their aging populations. And Manchester was one of the first cities in the world to be formally admitted to the World Health Organization network. And the city is still seen as doing pioneering work through its age-friendly program, a partnership between different organizations, groups, and older residents to improve the quality of life in the city. For example, through a range of community-based initiatives in deprived neighborhoods and programs to promote the social and cultural participation of older people. And over the years, this work has significantly expanded, and in 2018, Greater Manchester became the UK's first city region recognised by the World Health Organization, and supported by the Mayor of Greater Manchester, who launched an ageing strategy focusing on the various domains of an age-friendly city. And the importance of such place-based age-friendly interventions is underpinned by research showing that where we live matters greatly for how we age and how we experience later life. And just to give one example of a study I've been involved in that came out recently, we showed that there is a causal relationship between neighbourhood deprivation and increased levels of social exclusion in later life. So we know that older people living in deprived areas have worse access to services and amenities, lower levels of civic, cultural, and leisure participation, and higher levels of social isolation. We also know that such inequalities between poor and rich neighbourhoods have increased and widened over the past decade, a pattern which has been further exacerbated by COVID-19, as highlighted in the evidence Chris mentioned about social and ethnic inequalities that are associated with the virus. Just to give one example, an analysis from colleagues at the University of Manchester has shown that COVID-19 related death rates rise by 25% in areas that have twice the average number of ethnic minority people living in them. Findings which to some extent can be explained by the increased likelihood of ethnic minority people living in deprived areas with high concentrated rates of poverty, increased pollution levels, as well as more multi-generational and overcrowded housing. So all of this begs the question as to whether the term prisoners of space rather than aging in place hasn't become a better term to depict the experience of community and a home among some older people during the pandemic. It is certainly the case that age-friendly initiatives are most urgently needed in areas with the least infrastructure and resources in place to develop such initiatives, for all the reasons highlighted by Chris and Sophie, with cuts in public services, the decline of social infrastructure, the pressures on the voluntary sector, all disproportionately impacting. So how can we build back better, and what should the role be of age-friendly work? A couple of areas I think we need to focus on, and the first is the focus on the importance of developing interventions in areas characterized by multiple forms of neighborhood and housing deprivation. And there is a clear need here for financial injections in the poorest neighborhoods, which will also be important to facilitate the development of place-based recovery strategies that allow for innovative ways of delivering services, which will build on locally based partnerships, bringing together the voluntary sector, health services, and social care. And a crucial role, I believe, for age-friendly work will be to develop and ensure mechanisms of co-production. Co-production to facilitate the central participation of older people in developing community responses, as well as the ability to reach out to the most marginalized groups of older people. Third, such place-based strategies will need to be complemented by a national strategy to tackle health inequalities and related social, economic, and ethnic inequalities, which have been starkly exposed and exacerbated by COVID-19. Fourth, and very importantly, I think COVID-19 is showing that there is a continued important role for age-friendly work to play in challenging the pervasive and stark ageism and the dominant narrative around aging, focusing on stereotypes of passivity, burden, and vulnerability. Given that there is a risk for greater age segregation, we would argue that the strengthening of ties across all generations will be crucial in developing an effective response to the community crisis. Fifth, we also need to complement a focus on promoting digital inclusion in later life, which is critically important and should be seen as a basic human right, but with approaches that support the development of and support of offline social connections and support, which is especially important for those who do remain digitally excluded. And finally, there's also a need for high quality data. There's a need for evidence-based policy making, and there's a need to recognize that COVID-19 is as much a social issue as it is a medical issue. So crucially, we are at a critical point where COVID-19 is inviting us, is forcing us to rethink the kind of society that we want to build or recover in the decades ahead. And whilst the focus will inevitably be on economic recovery, we would argue that ensuring the social and spatial justice for different groups of people should be a crucial part of the debate going forward. And to assist this agenda, the Manchester Urban Ageing Research Group, who we're all members of, have joined forces with a range of organizations projected on the slide to conduct a collaborative piece of research examining the experiences of diverse groups of older people living in areas characterized by multiple deprivation in Greater Manchester. And the aims of the work will be to collaborate with community organizations and activists, some of who are following this webinar today, to examine the responses to COVID-19 that have been developed and are developing, as well as the strategies for contacting and supporting older people. Secondly, the aim of the research will also be to examine longitudinally with multiple telephone interviews conducted at multiple points in time, the impact of social distancing measures on experiences of everyday life amongst older people from marginalized communities. And third, the aim of the research will be to generate evidence to assist policymaking, aimed at increasing support for older people and organizations working on their behalf. And if you're interested in the research, we will provide regular updates on our website, and we look very much forward to hearing your views and very welcome your inputs and ideas in developing this project. These are a couple of key references. We have written a couple of blogs on these themes, and we will now look forward to having a good discussion about the ways forward with you. Thank you so much.
Thank you very much, Tina. That's great. We now are open for questions. So to remind everybody, please put your questions in the chat, and I will select them and put those questions to the panelists. So our very first question is from Hannah Cross, and the question is for Chris. So she really enjoyed your presentation. You mentioned the need for integration of care homes with the community, which Hannah agrees with. What do you think is the best way to approach this, Chris?
Well, I did, Hannah, thanks for that question. It's interesting, before COVID, residential care had not been one of my particular concerns, but I have started writing a bit about it. And it's enormously concerning, obviously, all of us would agree, what's happened. And I think, there are a range of organizations, government and so on, that we can say, well, you need to hold your hands up. But it's also the case, I think we all need to hold our hands up, in the sense that when we think about community interventions, we don't think about the residential care settings, or at least I haven't, you may have. We don't think about the residential care settings within our communities. Now, to some extent, there has been work done on this, in the sense that there have been interesting intergenerational programs which have involved care homes. And I think, those sort of things we need to develop more. But, and it's something, I really feel I need to work on now, really assess how, when we're thinking about community organizations, how do we locate care homes within that? And of course, one of the problems is it's a very fragmented sector. Majority of care homes are themselves private. So there is a kind of challenge there in terms of doing this work. But I'm pressing my own professional organisation, British Society of Gerontology, to take the lead in rethinking the whole relationship which residential care has to the community, the whole purpose, indeed, of residential care. I mean, just a final point, of course, the fact is that it's also about our concerns for people diagnosed with dementia, because the majority of people in care homes have been diagnosed with memory problems or dementia. So it is also about the impact of COVID-19, all of the changes that we're experiencing on people who have dementia. And I think this is also part of the debate. So I think we need to really develop a good discussion on this issue. Thanks for raising it.
Okay, thank you, Chris. Here's a question from Kathy to all our speakers. At the beginning of the crisis, negative language was used about older people. What can be done to reduce the perception that older people are less valuable than their younger counterparts? Tina, Sophie, do you have any such suggestions?
Yeah, I think that this is clearly an issue that has been, shown very starkly by COVID-19. The narrative that older people are a burden to society, to the economy, to pensions, that older people are vulnerable, the way in which the media has presented older people, the way in which Policymakers have talked about older people being a separate group. All of this has really kind of exacerbated the view that older people are a burden. And I think this is an issue that needs to be addressed at different levels, in the media, by society in general, within our communities, by highlighting the valuable contributions that older people do make in various aspects of our society, as entrepreneurs, as volunteers, as carers, as workers. I think changing the narrative also in a way that highlights this, you know, the difficulties faced by different generations within the context of COVID-19, rather than segregating the issue and creating a divisive narrative around it is really not helpful. And I think addressing this will need to take efforts at all these different levels to change the narrative of aging into a more inclusive, diverse one that reflects the diversity of experiences in aging.
Sophie, would you like to add anything?
Yeah, just a little bit about the importance of outreach work and different innovations in outreach work, which we're already seeing. And a lot of what Tina and MICRA have looked at is co-production with older people, so how older people can be enabled and supported in being involved in making decisions in their communities and their cities, etc. And as people are encouraged to stay at home, or maybe have to stay at home, looking at new, more innovative ways of supporting co-production with older people, so that older people are still able to have that presence and visibility within communities and societies, and to feel more visible in that way. I think that's a kind of bottom-up way of addressing some of those needs, I think.
Great. There's a question from John, who says, changing the narratives around aging will be quite a challenge. What do you think our first steps should be? Are there any quick wins? Any suggestions from our panelists?
Sorry, Tarani, can you just repeat that? I'm sorry.
Yes, any quick wins regarding the first steps for changing the narratives around aging?
I think perhaps involving older people in developing community responses will be the critical point. And this builds upon what Sophie said in terms of co-producing solutions that work for older people. So involving and working with people locally, including aging populations, and developing recovery, place-based recovery strategies will be critically important in my view.
Yeah, I think that's right. I think also being kind of focused, I think, will be important. I mean, one of the challenges, I think, is that, you know, we now have an incredibly diverse group. I mean, if you take older people, you know, anyone over the age of 50, let us say, it's an extraordinarily diverse group in social terms. So I think being much smarter about who we're concerned with, what are the issues they face, you know, to take one example, I think there's a real danger coming out of COVID that so-called older workers, and it's an imprecise term, but let's say people in their 50s and 60s, will become largely invisible in terms of strategies for recovery. I think this is something Centre for Aging Better have highlighted, but others as well. So I think, you know, there'll be, in that example, a very important discussion to have with employers, with other groups, about what are the supports that older workers will need. How can we ensure that then they don't face specific forms of discrimination within the workplace? What are the challenges for them coming out of a COVID where industries which they may have been attached to have just fallen away? I mean, I think, you know, we must become much more precise and specific in our language if we're going to get the strategies, I think, to help people.
Thank you, Chris. So there's a question asked whether slides will be shared. So yes, definitely we can ask our presenters to share the slides, and we can make a link to that. There's a question from Camilla saying, asking about action. How do we turn people's increased awareness of health inequalities as a result of COVID-19 into a demand for action and real change? It's a tough question. Any suggestions?
Well, I think you make people more, I think people have to be, again, much more aware of public health issues and public health as something which communities can take charge of. I think, you know, there are a lot of potential ways we can do this. I mean, it's clear that different groups, particularly within low-income populations, often lack the resources and may lack the knowledge to be more directive, more proactive about their health. But I think we need to put we need to really put pressure on government to restore the budget to public health, health education, which has been cut relentlessly since 2010. We took out £900 million from the budget of public health, for public health and health education. And this had a real impact on low-income communities. So they weren't getting advice about obesity. They weren't getting advice about alcohol education. Mental health education was cut. So, you know, it's a lot to ask people to look after themselves when you're not providing the resources to make that happen. So I think it's got to come from both ends. And if COVID-19 has, you know, taught us anything, it must be about empowering communities so that they can really take a much more directive approach on health issues.
I'm going to link this with a question from Luke, who's also asking about how do you influence the decision makers? And he's using the example of local authorities. You know, all too often within local authorities, there's a two-track conversation going on where planners are very focused on physical environment and aren't necessarily interested in talking to those more interested in the social side of things. I'm wondering, Tina, Sophie, Chris, you probably got some really great examples where you have been talking to local authorities, where you have been able to put into action some of the research findings that you've been working on. Could you talk a bit about that?
I think one thing I want to say about this is I think there is great potential through working through what has been established in Greater Manchester now through community hubs, where different partners are coming together with the local authorities playing a very important role in creating a platform for place-based local agencies to come together. And I think these are, you know, possibly the community hubs would be something that continue to exist post COVID-19, and I think this will create great opportunities to work with local authorities in partnership to address some of the health inequalities that are experienced in, you know, the poorest neighborhoods. So I think working in partnership there is and has been our experience is the way forward in terms of making a difference and making sure that people listen to research evidence.
Sophie, would you like to add to that?
Yeah, just to build on that, I think from our research, the strength of skills in community networks is quite astounding, and the level of knowledge and expertise that is there. But there is just not the support to be able to do any kind of horizon scanning, scoping work. So I think there needs to be a big investment in leadership within leadership skills and programs within community and voluntary organisations to allow them the time and the capacity to be able to do that kind of bigger scale planning and be more engaged in a meaningful way with policymakers and other decision makers at different levels, as opposed to working on the ground all the time to be able to have that space to kind of like look up slightly and kind of do more kind of future planning work. So I think investment in leadership will be crucial for allowing that dialogue to take place.
Yeah, I just like to reinforce that. You know, I am very committed to the idea of community workers and community development, and these can be statutory, but equally they can be people who are well known in their communities, who have credibility in their communities. But I think we should be looking to give more support to those people, give more training to those people. You know, who are the leaders in communities that local services, local authorities can relate to. Often they do it quite well, but often it's very haphazard. So you know, I think there's a lot of scope there, and you know, I think the leadership issue, I think Sophie's quite right. You know, that's going to be extremely important for making it a clearer feature of what we're doing.
We've got 5 minutes left, so I must apologize. I won't be able to get to everybody's questions. Some questions like from Shaylee about contact with medical professionals, which is very important, of course, but not exactly the specific subject of today. Lynn's very concerned about the huge number of non-visible participants on our Zoom call. That's because we switched off their videos. So that's the main reason why, just to save on distractions. Michael's asked quite an epidemiological question about whether the death rate in deprived areas is greater than the infection rate. But again, probably not quite the focus of our speakers' topics here today. So apologies to everyone. I'm skipping over quite a few of your questions to get to some that perhaps are more relevant, like from Barbara. So Barbara's asking, are you aware of any areas where social and spatial justice is being considered equally alongside economic recovery, and how this might be achieved?
I think the research that we are developing with our group is focusing on areas where we think there is the most strong need for interventions in areas, so the focus is on deprived areas. And the initial findings from the kind of first interviews that we have conducted, both with community organizations and community leaders, as well as older people, are that there are actually already very good examples being developed in terms of local leadership with, for example, a number of the people who we've interviewed referring to very particular people in the community that have got these immediate links with a number of groups of older people and can actually develop initiatives or responses in response to the emerging community needs. So I think the research that we are doing is going to highlight a number of these good practices that are emerging in those neighborhoods where community leaders play an important role in addressing some of the inequalities faced by older people.
But it is undoubtedly the case that if you take Greater Manchester, if you took Birmingham, if you took Leeds, you would find a considerable amount of spatial inequalities in the sense of people, as Sophie points out, different levels of access to community resources of different kinds. And that's been exacerbated, of course, by the privatization of land, which has happened, you know, over the past 2 decades, really. We've had big take-up by private corporations of land which was previously owned by local authorities, which was previously owned by ourselves, in other words. And that actually is quite a challenge. Building the age-friendly communities, which Tina was talking about, in the context of cities which have become progressively privatized in terms of many of the spaces. So I think, you know, we've got to kind of really debate this much more vigorously coming out of COVID in terms of the kind of spaces we want and how much support they're giving us.
Thank you very much, Chris. Sophie, would you like to have one final comment before we close the webinar?
It's quite a big ask. I think just kind of, you know, summarising what Chris and Tina said and all the presentations is, you know, in the rush to reopen the economy, I think the social economy and the dangers of the social recession needs not to be lost. And there's a very crucial age-friendly dynamic within that I think all our work has obviously spoken to. So just to, I mean, a lot of this work will be very familiar to the people on this call, so it's almost preaching to the converted, but I think there's a re-emphasis to kind of restate these arguments, and there's almost an opportunity to restate them in light of the COVID-19 and the kind of crossroads, I guess, we're at in some respects.
Well, thank you. I'd like to thank all our speakers today, who gave up their time and gave such great talks today, and also to all of you who participated in the chat and asking your questions. Those of you who are interested, the slides and recording will be made available on the MICRA site next week. So please do go on the website, and we'll be keeping you informed about our next webinar, which will be arranged quite soon. So thank you again, everybody, and have a good day.
Thank
Bye-bye.
you.
Thank you, everyone.
Thanks, everyone.